There has been so much discussion of late about vaccinations and whether taking it should be mandatory. You'll agree, right? Well, the Ministry of Health and Wellness reported that 367 coronavirus cases were confirmed in the past 24 hours. And then now with the recent spike in cases and the highly contagious Delta variant also rearing its head in Jamaica, the government has faced numerous questions about whether it will now move towards mandatory vaccination. Let's assume that vaccination does become mandatory. How would that work? Joining me today for this discussion on mandatory vaccinations is partner at DunnCox Attorneys-at-Law, Mr. Emile Leiba. Mr. Emile Leiba, good afternoon. Welcome to Home Run on the Edge. What does mandatory mean, sir? Hello? Hello, good afternoon. Emile Leiba is with us here on the... I keep on saying Leiba. Why am I doing this now? Mr. Emile Leiba.
Yes.
Welcome to Home Run on the Edge, sir. Mandatory vaccinations. First of all, let's break it down basic and simple for everyone. What does mandatory mean legally?
Well, mandatory can mean many different things. It can be all the way from holding you down and, sticking a needle in your arm to denial of benefits or services or access if you do not comply. So around the world, they've been doing things like in France, where you're not allowed to go to restaurants and other public places unless you are vaccinated. So, to a Parisian, restaurants may be an essential part of life, and so therefore it would have made it mandatory.
Mm-hmm.
For us, we have experience with, the NIDS.
Mm-hmm.
So they tried to say that registration with NIDS was mandatory, and if you didn't register and comply, you would be denied access to government services. And almost every Jamaican needs to access government services at some point.
Mm-hmm.
And so to that extent, it was made mandatory.
All right. So just to remind everyone as well, if you have any questions on this topic, you can send them to our WhatsApp line on 876-383-1166. Or you may call us live to studio as well. The studio number 876-906-9559. We are here with attorney at law from DunnCox, taking us through the topic of mandatory vaccinations. Mr. Emile Leiba is with us today. So, sir, if the vaccination later does become mandatory, is there any basis on which a person can avoid taking the vaccination without being sanctioned?
Yes. In Canada, they've had that experience where they are mandating vaccinations for some persons or categories of persons, but you are generally allowed a religious exemption. So say some individuals, by virtue of the tenets of their faith, they don't believe in things like blood transfusions or placing anything in their body.
Mm-hmm.
So they would be acting contrary to their religion, were they to allow themselves to be injected with a substance. That's one aspect. And then the other general area of exemption would be for medical reasons. So if your doctor says that by virtue of a pre-existing medical condition that you have, it would make a vaccination would pose a danger to your health, then that can be a basis upon which you could seek an exemption without sanction.
Okay. But what about if I'm fearful about the effects that the vaccine will have on my pre-existing condition? But do I have to have a doctor confirming that, or if I can just say I'm fearful?
Depending on the structure of the scheme, it is not likely that fear alone would be sufficient, because it wouldn't be a very effective scheme if you could refuse on the basis of fear alone. Because even those who take the vaccines, I think, have some degree of fear and concern that it may or may not, impact them in some way. So, generally speaking, no, you would in order to qualify for an exemption, you would need some kind of medical certification.
And should I be treated any differently from vaccinated persons if I don't take the vaccine?
That again is something that they're currently grappling with. So one of the more recent examples I've seen is that I think it was Delta Airlines have said that you will pay more for your health insurance because they have had to pay so much money in health insurance costs to cover those who have been suffering from COVID. You will need to pay more if you're unvaccinated because the current belief or stance, as I understand it, is that if you're vaccinated and you contract COVID, your symptoms will be lessened and your likelihood of hospitalization will be decreased dramatically. And so there could be a basis for things like that. There have been some policies that speak to requiring more COVID-19 tests to be conducted. But again, the justification would have to be there to suggest that those who are vaccinated are less likely to contract and transmit COVID in the context of a safe workplace environment. There are, other things about certain areas which are only accessible by persons who are vaccinated, separating them in terms of the pool of staff. So there are various methods that are being tried throughout the world in terms of making a differentiation between vaccinated and unvaccinated persons.
Mm. And just a light one before you give us our did you know for us before you go. This must be an interesting time for you from an aspect of law. Just when you think things were boring and you're sitting on top of your game and everything, you now have to relearn the law. Am I correct in assuming that?
Yes and no. What you have to do is build on your foundation more. Mm-hmm. So you need to extrapolate from what you know and build upon that knowledge to look at general principles. And you realize I use examples from around the world because Jamaica has not yet created a legislative framework. So, but when we do eventually do that, if we do that, we normally look to what has been successful in other jurisdictions in order to determine what we think would be successful in ours.
And I guess this is what everyone is doing now during lockdown as well. Families get together. We're talking about these things, talking about these topics, and what do they mean by mandatory vaccinations? So we're happy that you have come and shown us that, you know what, everyone's working it out. It's just that for some persons, they're working it from a direct point of law view without emotions involved. And we thank you so much for coming here on The Edge and giving us that perspective to be able to converse with everyone with at home as well after the program is done. Mr. Leiba, any hashtag did you know information for us before you go?
Did you know that vaccinations are already mandatory in Jamaica?
Stop it.
So all of this talk, it's been mandatory since 1986.
Ah, gotcha. Because when we say vaccination now, we're assuming only one. We go immediately to the one that's right in front of us. But yes, we have so many others.
We've had mandatory. Jamaicans are more familiar with the term immunization than vaccination. You know, so if you're of that generation, you can look on I think it's your left arm, to see proof. That was your vaccination card. Mm-hmm. You know, you looked on your arm, and that was your proof of vaccination, and which you are required from 1986 to have in order to enter the school system and remain in the school system. So that has been in place since that time. And so when we are fearful of mandatory vaccinations, it's already here.
You know, thank you so very much. Emile Leiba, partner at DunnCox Attorneys-at-Law, and we look forward to another program, The Legal Landscape, next week. You always give us great information, great food for thought, and you help us along. Thank you so much for joining us this afternoon, sir.
My pleasure, yeah.
Thank you.